Well, I'd like to talk about some new and emerging therapies in myeloma, starting with CAR T cell therapy. Can you talk about who this treatment option might be appropriate for?
So yeah, just to kind of give folks background, CAR T cell therapy is a form of immunotherapy where we take out an individual's T cells and then reprogram them essentially to recognize myeloma cells. Right now, there's two approved CAR T products for multiple myeloma, both in the relapse refractory setting. And it's really for patients that have had four or more lines of therapy. So, that's a lot of different combinations that we currently have available. Those therapies stop working before patients are actually eligible for CAR T cells at the moment. Both of these CAR T cell products have been, game changers in terms of improving prognosis for patients. The good thing about CAR T cells is that it is, one and done treatment. So patients, when they go through that initial phase of therapy, they are then off therapy. Although we are now starting to study certain therapies that we may administer after CAR T cells to get them to last even longer than they currently do. But that's still in, for example, that's one of the clinical trials or many of the clinical trials that are currently ongoing now to try to answer that question. Patients, a lot of patients can be eligible for CAR T cells. They've had to have the prerequisite amount of therapies. Again, there are some sort of baseline fitness characteristics that we look at for patients' ability to tolerate it. But as a whole, I consider CAR T cell therapy more broadly applicable to myeloma patients than compared to, let's say, a stem cell transplant.
How has this therapy revolutionized myeloma care?
Yeah, before the first approval now a few years ago, in this space, we didn't really have anything like this to offer patients. So, many of the combinations and other compounds that were in clinical trials, would have, a response rate somewhere around, let's say, 30%. So a third of patients may respond to that therapy in that space, and that may only last a few months. And that was considered successful not that long ago. Now, with CAR T cell therapies and bispecific antibodies, these therapies are highly efficacious. You see response rates 70 to 100% in some of these immunotherapies. And what that's translating into is patients, disease staying away for a year, 2 years, even 3 years in some of these clinical trials. And again, this is completely unprecedented compared to what we had before.
I understand that there are a number of clinical trials for different types of CAR T, or even using it earlier in the disease. Can you share updates in CAR T cell therapy research?
Yeah, so exactly as you pointed out, there have been trials already actually that have been completed, phase 3 studies looking at CAR T cell therapies in earlier relapses. So patients that have had either one or two lines of therapy, both of CAR T products have been compared to standard of care in that space and have shown superiority. And this is something that we all been kind of waiting for to see if you deploy it earlier, perhaps you're going to see even greater benefit. And that seems to be the case in some of these trials. And now we're awaiting, hopefully, approval of some of these CAR T cell therapies to be administered earlier, because in fifth line, it's very different than treating patients in second or third line, which I think will really vastly improve our ability to deliver this therapy to many patients, as it can be quite challenging for patients that are in fifth line to allow them to go through the process of CAR T cells and then having them be administered. I was looking at it head to head with stem cell transplant, as I mentioned before. And this is in the context of quadruplet induction therapy, followed by either CAR T cells or stem cell transplant, and then followed by maintenance therapy. So really trying to see if I can overcome, what we typically have achieved with stem cell transplantation. We have also, are doing some studies even before that. So patients, again, in high-risk smoldering myeloma, which we know have an increased risk of developing newly diagnosed disease in the next few years, perhaps that could be the time where we can give, some of these immunotherapies. And that's some work that we have going on at our center.